Welcome, everybody. We will give it a minute or two and let people come on in before we get started. Thank you for being here. Thank you for everybody who just came in. Just going to give it another minute. People trickle in, and then we'll go ahead and get started. Right. Well, thank you for everyone that is with us. My name is Joseph Arnett. I am a policy analyst here at the Council of State Governments Justice Center. I want to start off by thanking you all again for joining our discussion on effective partnerships, maximizing capacity through police community collaboration. A brief outline of our agenda today. First, I'll provide a organizational overview of the Council of State Governments Justice Centers and what we do before we dive into our main topic. Next slide, please. Actually, one more. Awesome. We are a national nonpartisan, nonprofit, organization that combines the power of a membership association serving state officials in all three branches of government with the policy and research expertise to develop strategies that increase public safety and strengthen communities. Next slide. What do? We bring people together, drive the criminal justice field forward with original research, build momentum for policy change, and provide expert assistance. Next slide, please. We do this to break the cycle of incarceration, advance health, opportunity, and equity, and use data to improve safety and justice. Council of State Governments Justice Center is committed to advancing racial equity internally through our work with states, local communities, and tribal nations, supporting efforts to dismantle racial inequities within the justice systems by providing rigorous and high-quality research and analysis to decision makers. We help stakeholders navigate the critical issues this data reveals. We rely on stakeholder engagement and other measures to advance equity through guidance and technical assistance and improve outcomes across all touch points in the justice, behavioral health, crisis response, and reentry systems. With all of that said, we can move into our discussion. Next slide, please, and then one more, and one more. Awesome. First, I'll introduce our presenters today. Starting things off for us will be Jennifer Stiles, Program Manager at the International Association of Chiefs of Police, or IACP. I'll let her tell you more about IACP and their work when I turn things over to her. But I'd also like to introduce Inspector Nicholas Capriglione of the New Jersey Transit Police Department. And do feel free to insert any questions as we go on via the Q&A button at the bottom of your screen. I'll also monitor the chat in case something comes up there. Without further delay, Ms. Stiles, the floor is yours. Please take it away.
Great. Thank you so much. Good afternoon and good morning, depending on where you are in the country today. Um, I really appreciate the opportunity to be here and talk with all of you. I have been working with the IECP for about 14 years on many different things. I currently oversee all of our work that's in the behavioral health space. We do training and technical assistance for the Bureau of Justice Assistance on a couple of different projects in the crisis response area, to include our crisis response intervention or CRIT training, as well as the comprehensive opioid stimulant and substance abuse or COSIP program. So we'll talk a little bit more about some of those resources and lessons learned as we go today. So I'll be starting off a little bit big picture with some of the lessons that we've learned through some of these partnerships and programs that we've done at the IECP. And then you will have the privilege of a very deep dive case study from Inspector Gabriel about how his agency has really managed and formed a number of different really exciting partnerships. But before we jump in, I was hoping to learn a little bit more about who we have in the room. We have a poll that can launch anytime our IT friends are ready to put that out there. Just kind of wanting to find out if you're law enforcement officer, professional staff, behavioral health provider, community-based organizations, or if you have some other kind of stakeholder role in the justice system. So we'll leave that up for a moment. Again, we just kind of love to know who's here with us. I don't know if there's a way to show those results whenever we're ready with those. I see we have a state representative, Kelly. Thanks for joining us. Here we go. Thank you. Oh, okay. So we have a lot of different, looks like a lot of different folks today. So we have no law enforcement. So we'll have to, for those of you who are looking to partner more with law enforcement, we'd love to talk to you about ideas for that. Lots of professional staff, which is great. Behavioral health providers. I see we have a number from community-based organizations. And yes, if those of you who are in that other category and would like to share your role in the chat, please do so. But thank you all for participating in that. It's really good to know kind of where our audience is. And we can jump ahead to the next slide. Thank you. So I wanted to give just a little bit more context to IECP and who we are and kind of how we do the work that we do. So we are a nonprofit organization headquartered in Alexandria, Virginia. We've been around since 1893. We have a membership of 34,000 in more than 170 countries. And this membership is made up of sworn officers of all ranks, as well as other policing professionals, psychologists, physicians, academics. So it's a really broad range of individuals who help us to really understand and inform and advocate for the key issues of policing today. And through that work, we do quite a bit of training and technical assistance on a wide variety of topics. And our topic today of community collaboration and partnership is such a core component of all of that work that we do. We're looking at things like violent crime prevention, victim services, like even data and technology. It's something that we really focus on and have learned a lot of kind of tried and true lessons about that we're excited to share with you. And it's really, I think, especially important in our behavioral health crisis response work that we're primarily here to talk with you about today. Next slide, please. So just to kind of, again, sort of level set us, I wanted to start thinking about definitions when we talk about partnerships, because partnerships can be many different things to different kinds of people and different types of agencies. So these might be things that are formal MOUs and really detailed job descriptions and roles, or they might be very informal types of partnerships. We might be talking about partnerships that have many, many partnerships, or just sort of a one-on-one relationship you have with a community organization. We might be talking about long-term projects or just kind of short-term projects that you're trying to address quickly. So for the purposes of our discussion today, we're kind of thinking about all of those different types of partnerships and the ways that they can support us. And as we're sort of in this foundational slide, also wanted to kind of think about, important to think about why we're talking about this. Why is this important to agencies? So I'm going to run through some of the benefits that we've seen and experienced, but if there's anything that sort of resonates with you or that we're missing, feel free to drop those things in the chat. First, I think it's important to acknowledge how partnerships can really improve outcomes. Police are often the first to respond to many crisis situations, but they don't always have, the most effective tools to deal with every situation. So when we can form effective partnerships, it really gives us the options to be more responsive and reactive, be less reactive, I would say, sorry. Partnerships help us really think about ways that we can be proactive and try to address some of those cycles of recidivism and trauma and really leverage treatment and services in ways that get to the root cause of issues. And when we are using those best tools and resources, we're really able to better improve health and safety outcomes for individual level as well as community level issues. We know that partnerships can also help address capacity. Many of our communities, police are dealing with lots and lots of calls every day. They're getting 24/7 calls. Often they may not have the staff that they need to do that. So when we're talking about establishing partnerships with experts, we can really alleviate some of that strain by redistributing some of that workload to help all the partners kind of handle their work more efficiently and effectively. And really beyond that logistical side, partnerships can also help add capacity in terms of our subject matter knowledge and lived experience that can help us address these issues a little bit more effectively and also authentically. One example that comes to mind, we work quite a lot with agencies that are trying to improve services for individuals with intellectual and developmental disabilities. So this isn't something that, the law enforcement agencies may know a lot about to start with, but by partnering with services agencies that provide these resources for individuals with intellectual disabilities, they're able to provide things like role playing for officers, service connections, and other ways to really make sure that, again, we're not just providing more services more efficiently, but we're doing them really well. Of course, that service piece is so important to the partnerships, and we're going to talk a little bit more about that in the next slide, but being able to increase access for services just means that we have, more pathways for more individuals to connect with all the different things that we need. And as we're thinking about partnerships, I think, a lot of times we're thinking about those vulnerable populations and community members, but partnerships can be really effective across kind of our public safety sector as well, thinking about services for crime victims and witnesses and perpetrators. And so again, just kind of thinking sort of big picture when we think about partnerships can be really effective. And finally, I just kind of wanted to mention, of course, the highlight of the benefit for partnerships to enhance trust and transparency between police and the people they serve, which is a really important part of improving community stability and officer safety, and again, kind of making sure that we're providing the best resources we have for everyone in our community. Next slide, please. So when as we mentioned on the last slide, that service delivery piece is really a key part of, especially, our crisis response programs and mental health response programs that we're working with in many communities these days. So these are some of the key types of community partnerships that we see: mental health service providers, substance use, disability services, basic needs being things like maybe you have connections to employment services or childcare. There are those food resources, some of those just real basic needs that people need to survive, and of course housing services as well. So we do have another poll here. We wanted to find out from all of you sort of what are some of the types of partnerships that you already have, as well as what are some of the partnerships that your agency or community might like to see or really sees a gap with. So this first one here is, what does your agency have? So if you can let us know which of these are existing in your community, kind of at a large level or even at a smaller level. And whenever we're ready to bring those results up, that would be great. If everybody's had a chance to chime in. Okay, great. Well, I see we have a lot of mental health services, which totally makes sense. I think that's something we've made a lot of progress on. We have about 50% of people responding that they have a mental health service. We have 10% who are using substance abuse services, 10% with basic services, and some of you who are really just starting out, which is, we're great that we're glad you're here and able to think about some of the ways that we might be able to expand that. And then maybe we could launch the next poll is kind of, what would you like to see, especially for maybe our 20% who are still working on forming some partnerships? What is sort of needed in your community that doesn't exist already? And I would say, think about this big picture, money is no option. If you could what would you do if you could have these services? What would be your best case scenario? We have the same list of options here: mental health, substance abuse, disability, basic needs, and housing services. And whenever you're ready to bring up those results, we can take a look. All right, kind of a mixed breakdown here. We have 11% are looking for mental health services, 11% with substance abuse, basic needs. I see it. We have a jump here in housing services. 33% of us are really looking for better partnerships for housing. And a couple of people are thinking maybe they have what they need right now and have none. So thank you all for letting us know kind of what you're thinking about. I think that's helpful to myself and also to the inspector as we move on to kind of helping you think through some of those need areas. All right, next slide, please. So in the kind of the final piece of my presentation for you, I just wanted to talk through some of sort of the big picture ways that we find it's effective to go about starting a partnership. And again, using that sort of broad definition of a partnership can be whatever it needs to be for your community. And I think that leads us really well to that first item here we have, which is understanding the problem and goals, which is a very important place to start. I think it's, problem identification is one of sort of the key tenets of community-oriented policing, that problem solving. We find that sometimes you or your agency or your mayor might think you know what the problem is, but your community might think it's something else entirely that they're worried about. And if we're putting a lot of resources and time and money into a problem, we want to make sure we're really solving the right problem and that we're going to come to the right solution. So as you're kind of getting started, it's really important to take that time to listen to the community and figure out what they think the problem is. As well as all your other stakeholders. When I say community, I mean community very broadly, to talk about our people who live there, people who visit, your business owners, really kind of getting that comprehensive details about what's going on in your community is going to help you define the size and the scope of the issue. And also thinking about what outcome it is that you and your community think would best address that problem and fill that gap. And then once you have your problem identified, you want to work on removing some of those barriers to addressing that problem. That might be programmatic barriers, things like thinking through how you're going to fund it, how you're going to staff it, what kind of volunteers you might need, or community councils, approvals, and then also thinking about some of the barriers to engagement. Thinking about how you can make your partnerships and your programs as low barrier as possible for the people that you're trying to serve. This might be thinking about ways to make services available at the times that we know people need them, or looking to reduce the number of handoffs that a person might have to go through to get to the services that they need. And then once you've done that stuff, we kind of move on to the resource mapping. So we sort of understand what it is that we're trying to do, where we want to get to, and then thinking about, what resources do we have already that we might be able to leverage, and what do we need? And there are some really great tools out there to do community resource mapping. So if that's something anyone's interested in, we're happy to kind of connect you with some of those resources. We'll have some more information at the end about different resources that are available through the IACP and some of our other partners. And then next step is really bringing all those people to the table. You've kind of thought about everyone who's in your community who might be able to help. If you can bring them together and figure out, who is the exact right partner or partners to address that specific problem that you solved. And then it's really important to take that time to define roles and expectations. Thinking about, is this going to be a very formal partnership? Will you need a memorandum of understanding? How are you going to share data? And really thinking through all those different pieces. And I don't mean to present any of this as if it's easy. These things do take time and they take work and effort, but there are a lot of great resources out there to help you. And as I said, I'll be back at the end to share a few of our different resources at the end. So kind of wanted to stop there with our sort of big picture level, and then I will pass it over to the inspector to talk more again about what he's doing at his local level. So thank you all.
Next slide. So good afternoon, everyone. I'm Inspector Nicholas Capriglione. I wanted to thank the hosts for having us here today. Very excited about the opportunity to talk a little bit about what we're doing here at NJ Transit and in New Jersey. And I think it does offer a unique perspective for a lot of the people who are on this webinar. So a little bit about me: 25 years with NJ Transit. In that time, I've worked everywhere in the state of New Jersey, in some of the worst cities that we might have in the state. And unfortunately, there's cities that have a lot of need. In that time, I've had the opportunity to see a lot of different approaches to try and solve the problems that our nation is really experiencing. And we have a very unique perspective because of what we are and how that problem finds its way to us. And it's given us the ability to come up with some unique solutions that have offered relief and help people who are in need. Next slide. So, we realized a while ago, and I hate to use the adage because it seems to be played quite a bit, but we realized a while ago that homelessness, social service issues, they're not problems you can arrest your way out of. Homelessness isn't a crime, and those individuals are better served from other means than the traditional law enforcement approach. That doesn't mean necessarily that we can't recognize that there are certain points where there needs to be consequences for negative behavior, but we've come up with a way to kind of create an environment where those consequences are compassionate and become other opportunities to get people linked to services. So our approach really begins with a co-responder model that pairs our law enforcement officers up with social service providers and a number of different agencies as well. And I'm sure that some people who are on the call are like, oh, well, we do that now, but just bear with me, and I'd like to explain to you how we might differ from what it is that you guys do. Next slide. So I had mentioned before we're a state agency, and this is in where we found our methodology. We have stations, hub stations, everywhere from Newark all the way down to Atlantic City. So each of these hubs has a different issue that they're dealing with. They have different resources. They've made different approaches. They've tried different programs. But the common theme throughout all of them is our officers are in these spots trying to deal with those in need. What it's led us to do is realize that we have to be full-time social service officers. And what we do is we actually appoint full-time outreach officers to each of these spots. In Newark Penn Station, we have an officer there by the name of Officer Sean Pfeiffer, who's just phenomenal. And these officers, by the way, aren't just co-responders that actively observe. They're active participants in the process. Every one of our New Jersey Transit officers is crisis intervention trained. They all technically are outreach officers, but these individuals here are very special. This is all they do. In Newark Penn Station, we have Sean, we have Officer Lloyd, and we have an officer in the evening, Officer Nunes, who works there as well. And what these officers do is they partner up with providers. Any provider that wants to come into our facility and try to help those in need, we'll work with. And I'll explain to you how even that goes along and how that works. So Officer Furlong is in Trenton. Officer Kayla Young is in Camden. Officer Veneria is in Hoboken, and Officer Lejeski in Atlantic City. Could you go to the next slide? So basically our goal is to try to help people. That's what we're trying to do. We're trying to meet people where they are and link them to direct and immediate care or support or shelter. One of the things about what we do is that we recognize we might actually actively have to talk to somebody 40 times, and maybe that 41st time they'll look to take assistance. And when that clicks, that opportunity to be linked to those services has to be direct and it has to be immediate. Next slide. Now, the benefits that we offer are basically everything that you saw you had the opportunity to click off on, from housing to mental health care to medical care to assistance with substance abuse. And we do find a very diverse population in our facilities. And if you think about it, it only makes sense. We end up with a consumer group that could be, without residence and even without the ability to go to local shelters. And the stations become collecting points there. And the opportunity to have a basket approach and bring a number of different providers in to try to meet them and link them, it works and it makes sense for us. Next slide. Again, like I mentioned, the direct linkage to services is important. So if you can imagine an officer starting his day or her day, meeting up with partners, and those partner providers could be individuals with lived experience. They could be mental health professionals. They could be veteran services. They could be just clinicians walking around train stations, walking around bus stops, meeting people where they are and trying to link individuals to services, but not for the purpose of giving an enticement, like, and taking a name or just handing a card, for the purpose of trying to get them to say, yes, I want help, and transporting them right to drop-in centers, which we'll talk about in a second. Next slide. So these low barrier drop-in centers become basically areas where individuals, they can get out of the elements, they can get out of the city streets, they can get the opportunity to get a meal, they can get clean clothes, they can get the opportunity to get a bite to eat, use computer services. But our more successful drop-in centers have individuals that run them that actually have lived experiences, and they have the opportunity to connect with these individuals and offer them services and help. And this has been one of the keys to the successes that we've seen. And I don't know if anybody's aware or had seen it, but Newark, about for the last, I guess, the year of 22, October to October, had a 57.6 reduction in unsheltered homeless. And part of it was because of this collaborative effort that we did in the city of Newark. Next slide. And it is corny as it sounds, take a village. It's got to be a collaborative effort. At least that's what we found. And our collaboration could be multiple partners. It manifests as outreach, people coming out and meeting people where they are and linking them to services. Our appearance is important for our officers. And as I said before, we're not just active observers, which some co-responding teams are, we're participants. And we actually dress the part. We'll dress down. It could be jeans, it could be a polo, it could be khaki, it could be a polo. They're walking along with these providers, these officers, and they recognize that we might not be able to make a connection. We might not be the one who actually can, be the voice to link somebody to services. And we drop back sometimes and we let the different providers approach it. And, one provider might have luck on one day, another provider might have luck on another. Next slide. Just a few number of partners that we work with just here in Newark. There's a bunch. And just so you know, too, we don't pay for these providers to come out. These providers already exist in the city. And what we've done is we've actively looked for partnerships. And we've reached out for these different groups and asked, how can they help us and can they follow our model? Are they willing to come out to our facilities, work with us, train with us, and try to help people? And, there's no shortage of goodwill, and it's been very helpful. And this is throughout the state. So I encourage anyone who is looking to start a co-responder program, look and see who's there already. Look and see what neighbors you have, who can come out and who can help you. Next slide. These drop-in centers, I got to tell you, this is one of the most amazing things that has really turned issues around for us at our facilities, and I think it could help with communities as well. So these drop-in centers are very low barrier, and they offer shelter, not maybe beds and sleeping space, but a place to sit down, get out of the elements, get a bite to eat, and have the opportunity to be engaged with different providers. One of the unique things is that through this collaborative effort, we've been able to coordinate outreach with the providers very effectively, and they work together. You might see Bridges drop into our CSPNJ drop-in center to try and engage clients that are there. They might do their case management there on a patient. It's very much a partnership approach and a collaborative effort. And one of the things that the drop-in center does for us is it helps us with one of our approaches. In my time doing this, I'm not saying anyone has ill will with what they do or try to achieve, but one of the approaches that different groups have is to try to meet people where they are and service them right there, or provide case management right there. And there's an adage that we've been taught by Volunteers of America. It's almost like trying to have an AA meeting at happy hour in a bar. It's not going to help an individual with a drug dependency to continually be treated in the place where they're rooted in their habit. And what we try to do is use our providers and work with our providers to offer these things at the drop-in centers, which are a close distance away from our terminals. And it's helped. It's helped to get people off the street. Next slide. One of the other things that, is unique about us and, even the state, I don't know if anybody is aware of the ARRIVE program here in New Jersey, but the Attorney General here in New Jersey had come up with an idea to try and pair mental health screeners with officers and respond to calls of mental health and in crisis. And we ourselves took this, and it became something unique that now we're doing in the state and local municipalities are. And it's not just a co-responder in a car to a 911 call. It's active outreach on foot. It's walking around in areas where people might be camping and might suffer from mental health issues. It might be walking around a terminal looking for somebody who might need assistance, and also looking for those who might be outside their mental health baseline, and trying to engage them and assist them before there's a critical incident that an officer might have to use force, and get them assistance before they themselves end up in a situation where they hurt themselves or others. Next slide. The numbers have been staggering with what we've been able to achieve with Arrive throughout the state. I did mention to you earlier that, the stations do become collection points for those, consumers who have issues, and mental health co-occurring with drug addiction is a big thing that we see on a regular basis. And this community really does need the help. And having screeners come out and be able to engage and get people linked to services, I really do think it saved lives. It has saved lives. We've been able to stop a couple of suicides this way too. And I think it's an amazing program that, different communities should look to try and replicate. Next slide, please. Operation Helping Hand is another program that we link with the Attorney General's office on. And this is a great program because this allows us to partner up, walk our stations and patrol with partner providers who have lived experience. And when I had mentioned that point of the spear and how we know we have to drop back sometimes, let our partners try and engage, it's amazing what this program has been able to do to convert people. One young lady, I'll tell you a story, was sleeping on one of our benches at North Penn Station, and we approached her from a team perspective and failed, didn't work. But that's our expectation. We know we have to do it multiple times. On another approach, the team went up to her and they were able to get her to go to the drop-in center. And she went to the drop-in center, and it turned into one of our successes because she stayed at the drop-in center. She was able to get treatment for her mental health addiction issues and her addictions, was able to actually get back on her feet. Turned out that she had become addicted to drugs. She was a psychology major with a master's degree in psychology. And now she comes out to our stations and walks our stations with our officers doing the same thing, trying to link people to services. Next slide, please. So there is a reality to things, and I think any officer that would be on this webinar would know that there are times when the consumer group does run afoul of the law. The issue with the traditional methodology of arresting and charging and fining is it just becomes a further barrier to service. And if somebody is in the box to get linked to services, it just knocks them out. And then the whole process and all the good work and energy and time that our providers have put into the process gets pretty much ruined. And, if they had the money to pay for a fine, they wouldn't be homeless to begin with anyway. So one of the things we looked at, and we take a lot of ideas from different groups throughout the state of New Jersey, was a diversion program that we saw in Camden. And we took it and we replicated and we created something called our outreach referral program. Next slide. It's basically a social service court, but the difference with our social service court is it's not held at a courthouse. Throughout the state at our partner drop-in centers, we have our court sessions held there. And I'm getting ahead of myself because I didn't even explain to you how these even get entered into the system. But the social service court is a drop-in center. And the idea is that if somebody does have a fine, we are able to divert it from traditional court to the drop-in center court. And an individual gets the opportunity to go and talk to providers first, get linked to services, try and work out a program and a means to get back on their feet, and then go before the judges and have their matter heard. And no fines, no incarceration is levied at that point. Instead, a plan is drawn up to try and help people, to get back to where they need to be. Next slide. So basically the way it would work, we're not trying to wrest our way out of the problem. And to say there's 3 strikes would be a lie. There's probably close to 30 strikes, if not even more. Because we find ourselves in a unique spot because we still have to be able to ensure that one person's freedom doesn't overlap with others, where one person's rights end and another one's begins. But we don't also want to make a situation where homeless people are being punished or being barred from any kind of services and opportunity. So our program's a little bit different than the leads. It's got elements of a lot of different things. Our first warning might be if it's a DP offense, deflection with the outreach officers, conversations, no incarceration, no charges. Second might be a pre-arrest issuance of a blue card. A blue card is kind of like a soccer foul card. It's not criminal. It's just a card. Hey, listen, this is an offense. Here are the list of providers. We try to send them on their way and get them where they need to be to get help and stop the behavior. The other one is the point of the arrest. This is the point where somebody would traditionally either end up incarcerated, traditionally in the past, or end up with a summons. And if a person has underlying social service issues, instead of being arrested and punished and fined, they're issued these blue cards. They're issued a traditional desk appearance summons, and it's loaded into our system, and it automatically sent over to the community service group, North Community Solutions, and the groups that are in the other courthouses throughout the state, and redirected from traditional court to these outreach courts that I had mentioned. This starts an entire process where the providers, us, the courts get involved to try to make sure that these traditionally negative encounters become productive and positive and can become means to be another attempt at social service. Next slide. Data collection. I don't want to bore you with numbers, but I had already mentioned that we will approach over and over and over again until somebody's ready to accept services. And just our officer engagements alone, 21 to 22, were 9,600. Next slide, please. So if we were to talk and give you an idea, and I hope that there are some law enforcement professionals on the webinar today, if we were to give some of our partners any kind of feedback, and these lessons were learned collaboratively through either our profit or nonprofit assistant groups that come out and help us, this would be the list. And the first thing is incentives and giveaways. So this might not make sense to you at first, because everybody always wants to give something to help somebody in need. And we're not saying that we don't offer clothes and we don't offer food and we don't offer other items. But the problem is when groups go out and just offer things to get a name. And the goal is to write the name down and basically, I guess, hope that they seek, help. We use incentives and giveaways as a means to try and offer somebody something to go to the drop-in centers. That's how we do it. And then we provide transport. There is a need for off-site services. Providing them here in the terminals or where people are tends to basically route them and anchor them to where they are. Direct services is extremely important. You have to be able to have credibility when you're dealing with this consumer group. They have to know that you're going to follow through with what you say. Too often, at least in the state of New Jersey, we'll see people set up tables, giving out sponges and water bottles and this and that, taking a name on a list, and then our consumers never see them again. There has to be follow through in regards to the things that you promise. Consequences for behavioral issues, but not as a barrier to services. I just explained to you how we've tried to create a court model that's not punitive. It's more or less another means towards assistance, and we've had a great deal of success with that. The value of peer counselors and their ability to engage. Learned experience is something that is just, it's gold. And I mentioned to you how we've seen success just in the last year off one of our own benches. And there needs to be an overall shift in law enforcement. I think that there's something to be said for the recognition that officers need to be more involved, but there's also limits to what we can do. I also think that from a law enforcement perspective, we got to recognize that our appearance sometimes can become a barrier to certain groups, and that this whole soft approach, this whole change in the way we present ourselves, whether it's khakis and a polo, for the officers that are doing outreach, that's extremely important. Consistency, which I already mentioned, we got to be consistent. We got to continually go out there, continually offer services, and not quit, because there have been so many times that somebody you talked to on a Tuesday 2 weeks ago takes help on a Saturday. And if we don't keep trying, it's not going to change anything. And the importance is simply knowing somebody's name. These are human beings, and I'm proud to say that, the people who will work for me, they recognize that and you shouldn't. You should never judge somebody at the worst point in their life, because I sure as hell wouldn't want to be judged at that point. And these are human beings. These are someone, and they deserve to be treated that way. Next slide. I think that pretty much closes me out. And I got to be honest, I tend to run at the mouth, so I'm surprised that it went that quick. I give it back to you, Joe.
Thank you so much. And I'll just say, as a soccer official on the side, I love the card analogy. It's a great idea. I'm gonna promote that greater use in law enforcement. We do have a couple great questions in the chat, so I will just start with the first one. And also, before I go through the questions, I'll throw it out there that if you're like me and sometimes you think of the question you wish you would have asked, like as soon as the meeting closes, do not hesitate. When we get towards the end of the meeting, my email will be on the screen. You can always reach out to me at any time, and I can assist you at that point. So, with that said, I'll start, like I said at the top. Ms. Walker asks, are you partnering with any local nonprofit research agencies or academic institutions to monitor, measure, and evaluate these collaborations?
That's a really good question. And, we work very closely with DCA, Mr. Michael Callahan, and he's got, I think, something going with Rutgers University here to try to look at statistics and numbers. DCA was the group that actually put out the 57.6% reduction in unsheltered number that I had quoted to you for Newark. You might even have seen Mayor Brock in the news talking a little bit about it in New Jersey. The numbers, though, are really kind of being collected and studied by the state through DCA. So hopefully that answers your question.
And if anybody on these questions has follow-up, don't hesitate to put them in the chat. Next question comes from Evan Kester. Is the New Jersey State Police Department a funder in the space for community providers? Ed's co-location is tremendous, and they're curious if that extends to incentivizing providers financially as well.
So as I mentioned earlier, we don't pay for the providers that come out to our facilities. The one grant, though, the OHH grant that I had mentioned for those with learned experience, that's provided through the Attorney General's office. What we do, though, is that under DCA, we will sign on for providers who are looking to get grants that can justify that they're going to come out to the facilities, they're going to meet people, they're going to help them. That kind of stuff we'll do, and funding can be, I guess, obtained that way, but we don't directly pay for anyone to come out.
Rebecca Graham asks, can you discuss who is establishing and funding the social service courts? Are they created via municipal ordinance, or are they part of the state judicial system? This has been something that's been floated in Maine on a city level, so they're curious how these fines and diversion processes interact with the judicial process.
So it's a good question. And one of the things we've been fortunate enough to have is the ability to use systems that are already in place. So Newark Municipal Court has Newark Community Solutions, which is an outreach group that's already embedded with them. Since Floyd, they've been doing a large amount of virtual court. And it became as easy as utilizing one of the providers' drop-in centers with virtual court linked to the community center that was already established in Newark and in Patterson and in Trenton and Camden and Atlantic City to link these court activities. What we needed, though, was to find a drop-in center that could accommodate the cases, and really was no cost to it for us. Now, as far as the state goes, I do think the Attorney General's office is funding activities like that and initiatives. But from our perspective, we were able to take advantage of stuff that had already been there. And I'd be surprised if other communities don't have the same methodology and ability to do it. One of the things we were able to do, too, is we utilize kind of like a web-based system to interact with the courts, so that when we have those blue cards that I had mentioned, there's actually multiple color cards. It depends on which of our commands you're at. But when you have those cards and you have that summons, you can actually take a picture of it, upload it, and email it right to North Community Solutions, and they get it instantly. And they know that case has to be set for the outreach courts. One of the benefits of us was that we found that a lot of the cities were willing partners anyway with the drop-in centers because they were looking for anywhere they could get to meet this consumer group. They were going to libraries, they were going to rec centers, and I guess nobody had thought at the time utilizing these drop-in centers would be even better because the consumers are already there. They feel comfortable and safe, and it's an opportunity for them to be engaged.
Thank you so much. And we have one more question, and unless others come in, we still do have some time, so feel free to add more. Martin Juarez writes, are there any new data types that would be beneficial to track, include to assist you in addressing homelessness in your context? And what type of data is currently being shared with other organizations, service providers?
So from a law enforcement perspective, we can't share our data. But from the outreach perspective, we are linked to HIMIS, and through DCA, the numbers and information is out there. We do share our information with the Attorney General's office, and that's where they provide the numbers that they put out there for the arrived totals. Hopefully that answers your question, because the data part, there's a couple things cops aren't really good at. One is math, and the other is spelling, and data is very close to math. So hopefully I was able to answer that for you.
Thank you so much. Any additional questions or follow-ups to any of the previous questions? I'll give everyone just a minute in case they're typing. And actually, if you want to go on to the next slide, I think we're turning it back to first thing. Here's some contact information for both the inspector and Ms. Stiles. And then I think next slide. I don't know if Ms. Stiles, if you want to speak to these, we have some QR codes that link to some resources that IACP can provide.
Yeah, absolutely. As I mentioned in the beginning, we do quite a lot of work in this in the behavioral health space, and we have quite a few resources, and they're all generally federally funded and available for free, which is always what we like in resources. So you'll see there's a number of codes here. The first one is we'll take you some information about our crisis response and intervention training technical assistance program. So these are, I think that many of you are funded by BJA through grants. So we work with some grantees as well. So I think one of the things that we have to provide that a lot of agencies find useful is peer connections. So if you're looking to find out other agencies that have done similar work to you, we have a lot of great resources and connections to help link you up with them. Through the CRIT project, we also work with a number of other national providers. We work with the National Policing Institute, Policy Research Associates, the American Correctional Association, and through those partnerships, we're really able to, and also, also with the ARC, who works with disabilities. So they have a lot of different expertise that they bring, and with those partners, we do provide that sort of direct technical assistance, but we can also connect you with a lot of tangible resources. So one of those is our CRIT curriculum, which is a 40-hour curriculum that is sort of what we like to call CIT 2.0. So it is it's basic crisis response training, but it incorporates intellectual disabilities kind of throughout rather than just as a module. It also takes the opportunity to kind of focus a little bit more on behaviors versus diagnosis from CIT. So we have worked really closely with CIT International on the development of that. So it's a lot of great resources. It's basically a curriculum you can kind of pull off our website and use in full or in different components, different modules that work for you. And then beyond that, the curriculum, we also have a number of different sort of individual resources, many of them sort of in the space of understanding best practices. We have literature reviews on a number of the different crisis response models, co-responders, community responders, some of those other ways that are just really up and coming. And I'm sure many of you are using some of them, but if you're kind of interested in getting some more of the research behind those, we have some great tools for that as well. A number of resources working on identifying individuals with developmental disabilities and responding to those. So quite a few. If there's anything really you're looking for in that crisis response phase, we're happy to share resources with you. We also have some resources related to substance use. We partner with Task, who also works on training technical assistance for BJA. So a lot of these program resources are related to diversion and deflection programs, and sort of, again, connecting you with some of those best practice strategies and different resources and an understanding of the literature behind all of those things. And we also have IAC Policy Center, which has been around for many years. But this is a great resource if you're looking to sort of back up some of the work that you're doing with policy guidance. So we have considerations documents that can walk you through some of the things to think about, language considerations to use. So those are available as well. We have different resources that are sort of about community response and a whole range of other topics. So if there's other things that you're looking for, there's a good chance we have a policy to kind of provide that guidance. So as I said, if there's anything that we at IACP can do, I know our contact information was on the last slide. We're happy to connect you with resources or through these QR codes. There's again so much great work happening out there. We don't want anyone to reinvent the wheel. So we're happy to work with you and with our partners at CSG to really make sure that you have all the access to all these great resources that are out there.
Thank you so much. And I am actually going to put one more thing in the chat. I had my own fancy QR code, but it was being a little problematic and not always working. So I'm going to use the old-fashioned link in the chat. Part of the Justice and Mental Health Collaboration Program brought to you by the Department of Justice, Bureau of Justice Assistance. We have 2 support centers that offer free on-demand training and consultation. Just send a request for support, like if you want to explore how to start a program such as this, or how to start the conversation around starting something like that, big or small. You can send a request in, and somebody here at CSG will reach out to you and do what we can to help support you. Extend totally free, and I'm happy to spread the word on those, and feel free to spread that link far and wide. There are 2. There's the Center for Justice and Mental Health Partnerships, and as well as a law enforcement mental health collaboration one. So hopefully some of you take advantage of that resource. Last thing, thank you again, everyone who came. There's a link on the screen for our distribution list to receive updates and announcements, as well as my email. If there's anything I can do to assist, please do not hesitate to reach out. And I do not see any additional questions. Like I said, if you're like me and you think of it 2 minutes from now, do not hesitate to reach out to me. I'm happy to pass along and connect as needed. So thank you all so much for coming. I really appreciate it, and have a great day.